The broadcast is now starting. All attendees are in listen-only mode.
Hello, I'm Jennifer Lisanti, the Director of Sales at Beere&Purves. Thank you very much for participating in today's webinar. This is our annual portfolio refresh webinar where we consolidate all of the carrier changes. The good news is there aren't as many changes as in years past, but we've already started receiving groups for January, so it's important to know the changes. A couple of housekeeping items before we get started are we will be sending a copy of the presentation to all attendees. Everyone is currently on mute, but we welcome any questions. Just type them in, and I'll try to address them at the end of the presentation. If I don't have time to get to them, or if I need to get back to you, I'll do so. So having said all that, we'll go ahead and get started. All right, so here's today's agenda. First of all, we will cover a brief overview of all the carrier updates for 2020. We're going to throw in some reminders for Q4, reminders on Beere&Purves services and resources, and of course, answer any questions, I'm not going to ask you any questions, I will answer any questions you may have. All right, carrier updates. So the first carrier we're covering today is Aetna. So you may or may not have written a lot of Aetna business recently, but it's important to note that they are very competitive throughout the state of California, but on a certain plan level. And you'll notice that that's the MC Bronze plan. It was the $66,000 and $6,800 for 2019. In 2020, you're going to see that it's the MC Bronze 50/50 $7,300 plan. And it's literally the most competitive PPO throughout the state, except for, I think, 2 regions. In addition, Aetna will be adding 8 new plans, which you see listed there, quick summary. And this is the time of the year where some of the carriers do discontinue plans, and Aetna is doing so as well with the Bronze EPO and MC version of their HSA. So a general overview is that Aetna is adding Cairo to all of their non-mandated state plans. So what that means is in the state of California, all the carriers, even those that don't participate on the exchanges, have to offer exchange mandated plan designs. So what this is saying is for the Aetna created plan designs, they will all include Cairo. If it's a state mandated plan, they will not include Cairo. The next bullet point there is that new for 2020, and this is an improvement, is that Aetna will now be offering 3 different full network HMO plan designs. So they were only having one HMO plan design that was on the full network plan. And so now in 2020, they'll have 3 different versions, which is a nice enhancement, giving more people the options. The other enhancement that they're doing for 2020 is that out-of-state employees in 2019, if they didn't reside in an MC network, then there was not a plan design for that employee for that Aetna small group plan. However, in 2020, what they're going to do is they're bringing back their PPO network. So for out-of-state employees that don't live in an MC network, they're going to have the PPO network always available. And that's the plan that will give those out-of-state employees coverage. The next bullet point is concentrating back on California as far as the Whole Health Southern California ACO. They are bringing this, or enhancing this really, to the market in 2020. So it is focused in Southern California, and it is going to be 26% less than a full network HMO plans. And in Southern California, a lot of narrow network plan designs do sell, and so they're going to be very competitive down there. You'll see they have the HMO and EPO and MC offerings, and which providers are included in each of those. Lastly, with this Aetna slide, we always get lots of questions on what are the value added for all the carriers. The medical premiums are so expensive nowadays. Brokers want to remind employees of everything they're really getting for that medical premium. So you'll see here what Aetna provides, just included in the medical premium. What's unique to Aetna is the first item there, where they have a program with Apple Watch. And so you can actually get an Apple Watch and participate in this program to help with fitness. So that's definitely unique to Aetna. And then they do have chiro and acupuncture discounts in addition to what you're going to get on the Aetna plan designs in 2020. Gym, fitness, vision, and hearing, which is kind of consistent with all the carriers. Moving on to Anthem. So with Anthem, they are competitive in certain regions. So you're going to see we have listed here Region 1, Region 9, which is like Santa Cruz, Monterey, Region 12, Southern California, 13, and 14. So all the carriers kind of pick and choose the pockets where they want to focus on, and those are the areas that in 2020 Anthem will be very competitive in. What's unique for Anthem is they have not been as strong in Region 1, which is really Sacramento, north of Sacramento to the Oregon border. And Blue Shield's been very competitive in that region for almost, I would say, 20 years. Anthem is now competitive and is starting to write a lot of membership. So if you have any groups in way north of Northern California, definitely look at Anthem nowadays. Moving on to the second bullet point with Anthem, you'll see that the annual rate change for the PPO plans is an average statewide of 9.5%. I will throw in there, however, that certain plan levels, the Platinum and Gold, are receiving higher increases than the Silver and Bronze plans. And that's directly because of utilization on those plan designs that you're going to see a bigger impact on the Platinum and Gold. Now, the Platinum and Gold are pretty much what all the Beere&Purves Anthem PPO plan designs that we've sold have been. So that's why some of these renewals are higher than this 9.5% we have listed here. However, when you go to market the renewal, you'll see that it's not like Anthem's blown out of the water. They're still competitive. It's just the renewal itself looks higher. And then with HMO with Anthem, you'll see it too is 11.2% average statewide increase. With all the carriers, unfortunately, when they're giving us these statewide averages, they're looking at what is a 30-year-old from last year compared to a 30-year-old on the same plan's rate increase. And we all know what happens with everyone as they get older throughout the year. So what we really should be comparing is what is a 30-year-old premium from last year to a 31-year-old this year premium increase. And that's why when you get your actual renewal, the percentage increase is typically higher than these statewide listed averages because of the age impact. Like Aetna, Anthem is also adding new plan designs, so you can see those listed there, and they too are eliminating plan design, that Bronze PPO plan. Now moving on to the fifth bullet point. You know, every year when we do this webinar, we talk about pretty much all the plan designs are getting watered down and premiums are going up, but not necessarily this year. So with Anthem, I think they're having some benefit enhancements in the sense that on certain benefit levels, which are therapies like physical therapy, occupational therapy, and speech, as well as their lab and x-ray, they're moving from a deductible and co-insurance benefit level to set copays, which always makes people feel better if they just know the set dollar amount that they're going to pay for different services versus having to just guess what that deductible amount and the co-insurance will be. So with lab, you'll see that it will be the set PCP copay, and with the x-ray, it's going to be the set specialist copay. Moving on to the Ingenio RX, if you sell large group Anthem, this is already hit in large groups, so you're probably familiar with it, and they've been talking about it for a while. So Anthem Small Group is moving all their small groups from their old PBM, the Pharmacy Benefit Manager, over to their own Ingenio RX January 1st, once the group renews January 1st going forward. So what happens there is that this is ideally going to help Anthem get a hold of these very expensive pharmaceutical costs that we're all familiar with and you hear about in the press, and you know, the legislators are all trying to talk about doing something about it. Well, this is Anthem trying to figure out a bring a solution to the table that will hopefully, one, probably help members be healthier using the most effective drugs, as well as keeping those premium dollars down. The next item I want to talk about is Life Health Online, and I know Anthem has been talking about Life Health Online for a while now, but they continue to enhance the benefits, as well as they're definitely seeing that their utilization for Life Health Online is getting better and better. They're finding that younger folks don't really want to run away, take time out of their busy day. Maybe it's not as convenient to go to the actual doctor. So doing the telemed with Anthem Life Health Online has been very beneficial, and definitely utilization is picking up. So what Anthem did in 2019 is that the first 3 office visits were free through Life Health Online. What's new for 2020 is after those first 3 office visits that are free, now you're only going to pay $5 copay for the 4th visit and going forward. That does not apply to HSA plans. It never can, because they can't give you a copay for office visits. You have to have that deductible or set dollar amount. So they're going to charge you a flat $59 as a new rate for the Life Health Online office visits. The next item listed there is Anthem's new member tool, Sydney, and I know all the carriers have it. Anthem had one. It's called Anthem Anywhere, the member app. And honestly, I'm an Anthem member, and I didn't really use that much before, but I'm definitely finding myself using the Sydney app. I think it's just more intuitive and easier. And so when I get an EOB and I want to check, or when I get a bill from my provider and I want to check the EOB, if it all matches, I can easily just go on my phone and match it up now. So I personally have found a great benefit in the Sydney member app with Anthem. The next item there is the special promotion from October through January. What Anthem is doing is they're a carrier that tends, to be very careful about offering networks side by side. So you have not been able to get two PPO networks with Anthem side by side to one group. However, they're doing this promo right now where only certain regions 1, north of Sacramento to the border, and region 9, which is Santa Cruz, Monterey, can right now through January have two PPO networks side by side. If you just do sell that to a group, they do get to keep it ongoing, even if Anthem chooses not to continue this promotion. Ideally, they find it beneficial, and brokers and groups like it, and there's not a problem with adverse selection, and so they open it up to all regions in California. But that's the current promotion currently. The second to last bullet point on this slide with Anthem is just a reminder. Most carriers do this, but we get lots of questions. Anthem has kind of gotten stricter on allowing you to change your anniversary from 1 month to another. But if you're moving to a January anniversary date with Anthem, that is one of the times they say, free game, anyone can move from, say, a December effective date to January with Anthem, no questions asked. So if you want to do it any other month with Anthem, though, you do have to get permission. So when you do that, though, just a quick reminder. So what we see a lot of is it's a December renewal. They do have to take the December rates and benefits for 1 month and then move to January rates and benefits 1 month later. So not the easiest that first year, but then once you move over to January, it is definitely clean with deductibles and out-of-pocket maxes, especially HSA plans, et cetera. So we are finding last year that our business, 60% of the business comes in between December and January. Last year, it was literally split evenly between December and January, and I'm actually anticipating that we get even more business in January of this year than we do in December. It's kind of flowing back to different dates lately. And then just like Aetna, the last slide here with Anthem is a quick summary of all the value add. A couple unique things with Anthem is they do give a free EAP to all medical members. So that's just automatically included in the medical plans. Pay forward is what they've been doing for a while. That's where you get cash back for retail shopping at certain vendors. And then they've got their special offer discounts that they've had for a while. We've been mentioning the new trend in the world is this Pro Clear aligners, which is basically those plastic trays for orthodontia. And if you're an Anthem member, you can get those at half off. They also have some good discounts with a company called Win Fertility. And that is very nice because that question seems to be popping up a lot more again lately is infertility issues. All right, moving on to CalChoice. For 2020, they don't have a ton of changes. So just a couple items for 2020 with CalChoice. They are, just like everyone else, adding some plans and discontinuing plans. So you can see they're adding 3 Health Net HMOs and 1 UHC HMO. Likewise, they're getting rid of 1 Health Net HMO and 2 HSP plans, and UHC is also discontinuing 1 HMO plan within CalChoice. What is very nice, and this is probably the biggest change for 2020, is that CalChoice will now have the Health Net full network HMO within CalChoice. Recently, Anthem rolled out their full network California Care HMO plan. That was in September 2019. So now with CalChoice, you have a full network HMO through Health Net and Anthem. And then just like all the other carriers, we've listed the value adds that you're probably all familiar with CalChoice. They've got a great discount program for entertainment purposes like movie tickets, sporting outfits, and like water parks through CalPerks. They've got the fitness items and gym discount, which is fairly new to CalChoice, called Choose Healthy. And then the other items that they've had there for a while, but just a reminder. All right, covered California for small business. This is a newer contract for Beere&Purves, so I just want to tell you what's going on for 2020 and just give you a quick reminders on why you would cover California in general. So the first item there is that they are going to be replacing Chinese Community Health Plan with Oscar. So Chinese Community is located in the San Francisco Bay Area. That is no longer an option through Covered California, and they're replacing it with Oscar, who is actually a Southern California carrier, very popular. It's that new carrier in Southern California, really based on the millennials and wellness and kind of bringing a newer edge to insurance, but that's more LA area focused. So my quick reminders with Covered California, just because a lot of our brokers are getting used to selling them, and when would you sell them? The nice thing with Covered California is they have a full network PPO through Blue Shield and HealthNet. Now the HealthNet full network PPO plan is only for California members, not for out-of-state members. If you have out-of-state members, you just simply put them on the Blue Shield PPO. So unlike CalChoice, who doesn't have a full network PPO, Covered California does through Blue Shield and HealthNet. The other thing we like to remind our brokers about is with Covered California, the nice thing, since ACA's Kaiser really believes in rate parity, whether you're going direct or through either the exchanges, Covered California or CalChoice, the rates and benefits are identical. However, Covered California actually has less expensive rates for dependents than Kaiser Direct. And the reason is Covered California does not include pediatric dental. As a result, you'll probably save about $14 per month on each employee dependent per month. So if it's an employee-only group, you're not going to see difference in the premiums, but if they have dependents, you will see that Kaiser through Covered California is less than Kaiser Direct. And then this is that wonderful time of year where per ACA, there's that special open window that groups can take advantage of. The special open window is for groups that are not meeting participation or contribution, and they, as long as they enroll in a certain window from November 15th to December 15th for a 1/1 effective date, they can be approved with that carrier, no questions asked. We have specifically put this item under Covered California because Covered California is the friendliest carrier in this situation. The reason why we say that is because Covered California offers Kaiser within Covered California, but also through the special open window, you could keep your Kaiser Direct plan and sell your non-Kaiser members through Covered California, put them on that full network Blue Shield PPO plan, for example, and the group will be renewed year after year. So all the other carriers have to do the special open window, but they have certain criteria, which we'll cover a little bit later. But this carrier in particular, Covered California, is the friendliest for special open window this year in 2019 for 2020 effective date. The other item that Covered California is trying to make sure that everyone is aware of, because it is new, is they do have a new broker portal, and they keep enhancing it. So I think here pretty soon you'll be able to do adds and deletes on the broker portal. That's the next enhancement they'll be rolling out. And then for those brokers that have not sold Covered California, there is a certification required, but it's not like the old days where you had to go sit in an 8-hour class and take 2 tests. This is simply a 1-hour certification. You can do it, anywhere on your online, and it's 1 hour. It's really not educating you on the product. That's what we can do here at Beere&P. It's really about HIPAA and security privacy rules. And once you do that, you're good to go and you can sell Covered California, your certified broker. All right, our next carrier we're going to talk about is HealthNet. HealthNet is back to being what they've always been very good at, is a Southern California narrow network HMO carrier. So you may not have been selling them a ton lately, but if you have Southern California groups, you will be selling HealthNet. Their sales that have definitely picked up down there. And they've introduced, just like everyone, they've got a couple new plans coming out, which you'll see there, and discontinuing others that are listed. The fourth bullet point here is really kind of the other new items for 2020, and that is they're bringing some focus on dental and vision. So they have voluntary dental and vision. You just have to have 2 on each plan, but there's not a D9C or payroll required when you submit those groups. And they have a new vision, simple enrollment form as well. So just trying to make those ancillary carriers. That's kind of the new bandwagon, as all the medical carriers are trying to sell their ancillary. Now HealthNet's kind of jumping into that as well. The last item here with all the other carriers we've had is their value adds, which kind of they've been having for a while, but as a reminder, what's included. All right, Kaiser Permanente. Beere&Purves is thrilled to be a Kaiser Permanente direct GA effective December 1st. We've already sold a lot of December 1 groups, so thank you very much for your support and your true excitement for us when we made our announcements. So there's some more information on this slide. Not all of it is for 2020, unlike what we try to do on all the other slides, but some quick reminders because they're new to us to make sure that everyone's on the same page. The first item there you're going to see, as I indicated, that Kaiser has rate and benefit parity whether you go direct through Kaiser or through the exchanges. However, if you go direct to Kaiser, there's 5 more additional plans than you see through the exchanges. So there's just more plan offerings when you go direct. But if you go elsewhere, it's the same thing, you're going to get Kaiser direct. The second item is there's no limits on the metallic offerings. So this is talking about how many plans you can offer to certain groups. So you see what Kaiser does is they do it by group size. For the smaller group of 1 to 5, you can offer up to 3 plans maximum. But once you get to 6 enrolling employees, you can offer all or any of the Kaiser HMO plans unlimited side by side. The third bullet point is just a reminder, because we get this asked a lot about the ALT, ALT, in the plan name in Kaiser plans. And if you see ALT in the plan name of Kaiser, that just means that the plan includes chiro and acupuncture. So what is new for 2020 are the next 3 bullet points. So Kaiser is also rolling out new plan designs, which again, you can see there. They are removing the gold $0 deductible plan, and that's kind of ruffling feathers in the market. So, just be aware that is a very popular plan design, and it will no longer be a plan option. So I think the lowest deductible they have now is $250. The next item for 2020, and I think this is great news, kind of like what Anthem was doing, is they're enhancing some of their products, is with Kaiser, finally, all of the plans are going to include DME. Before, DME full-blown was only included on 3 HMO plan designs. So now you can get CPAP machines, which are extremely popular for those people that have sleep apnea, oxygen, which is pretty important in our life, and of course hospital beds, at your home if you need those. So those items are now included on all the Kaiser plan designs, which I think is fantastic. The last item for 2020 with Kaiser is you'll see that even though they have grandfathered plans, and grandfathered plans are supposed to be kind of stagnant and not change because that's, they're grandfathered, that doesn't necessarily apply to HSAs because the IRS dictates new HSA rules every year. So you'll see that the grandfathered HSA plan through Kaiser is increasing their deductible from $2,700 to $2,800. Now, the next item isn't necessarily new for January, but it's newer for Kaiser, and I think this is another great enhancement they're doing, is they're trying to give more access to Southern California members that may not have as many Kaiser medical facilities nearby. So Southern California members can now go to Target clinics, and the nice thing about it is they're actually staffed with Kaiser members, or with staff people actually, not members. The member goes and sees a Kaiser provider in the Target clinic, and that Kaiser provider has access to the Kaiser members' medical records while at Target. So I just think that's a great, easy way to get care, especially for those annoyings like cold, flu, pink eye, strep throat, things like that you want to get taken care of quicker and don't really want more of a hassle of finding that appointment. Now, the next item is enhancement for out-of-state people that are traveling out of state. So when you have Kaiser members, of course they have coverage when they're in California, but one thing we get asked is, what about when you're traveling? Because they're not national. So what they're doing is for people when they go out of state, in 28 different states, because some of the states actually have Kaiser themselves, which you could go to, and they're trying to enhance this and grow it. But currently in 28 states, they can go to minute clinics for urgent care while they're traveling on business or personal throughout the US and outside of California. So again, just trying to get better access to their members. The next item is, this is fairly new, so that's why it's on here as well, is Kaiser no longer requires a D9C at all as long as you have a group, a 6+ enrolling with Kaiser. So this is kind of the trend. The carriers believe the larger groups, and they are just trying to process a lot of groups at once for December and January, so they're going to not nickel and dime them on the documentation that these groups need. So again, Kaiser 6 enrolling or more, no D9C required. Kaiser has also decreased their participation requirement. Now it's 50%, but Kaiser is like United Healthcare, and Kaiser counts the non-Kaiser members towards the 50%. So if between the other carrier and Kaiser, you're getting 50% of the group, you've met the Kaiser participation. The next item is Kaiser's getting, again, more and more friendly with underwriting. And you're going to see that Kaiser is now one of our favorite carriers for startup groups. So they, like Anthem, will no longer require payroll to be set up prior to the requested effective date. They now, too, have an attestation form that as long as the group is filed with the state of California and they sign the attestation form, then the group can get approved without payroll. So that's exciting, and we write a lot of groups that are startups. I think 60% of the groups we write at Beere&Purves don't have prior coverage. Owner-only groups, another niche for Kaiser, and Kaiser is the only carrier that we have that will actually potentially write husband and wife groups. Now, it has to be structured as a corporation or an LLC, and either the husband or the wife has to be on the D9C, but they don't require anyone else. None of our other carriers are going to write a husband and wife only group, whether or not they're on the D9C. And Kaiser is also very friendly in non-union situations. So if you have a group that's union, non-union, and you want to give medical benefits to the non-union portion, all of our other carriers are going to state you have to combine the two populations together and see if they're under 100. Well, usually by the time you add union and non-union members together, the group is over 100, and we can't write that. And then that large group carrier is really not interested in a 30-life non-union group. However, Kaiser is the only unique carrier that will only look at what is the size of the non-union population, and as long as the non-union members are 100, Kaiser will write that group in small group, which is great. One thing just to be aware of with Kaiser is they do not view individual coverage as a valid waiver, unlike all of our other carriers. The exchanges don't do that as well, so meaning CalChoice or Covered California, nor Kaiser Direct allow individual as a valid waiver. What's unique to Kaiser, and just to be fair, Covered California as well, is a group can choose to only offer coverage to their employees and not cover coverage to dependents. We're not talking about not just contributing to dependents, but the contract literally would not allow dependents to enroll. Two things to remember about that situation. The whole group has to be under 50, because of course groups of 50 or more have to offer coverage to dependents or they get in trouble per ACA. The other thing is if you're not offering coverage to your employees' dependents, the owner's dependents can't be on the plan either. So it applies to everybody. A newer item with Kaiser, so we thought we would mention it as well, is Kaiser is moving to paperless billing. If the group wants a paper bill, they can opt out, but they're going to be pushing or encouraging groups to do paperless billing if they're open to it. And then Kaiser has their value adds as well. A couple items unique to them is if you look at the last item, they actually have seasonal farmers markets, their medical group, centers. And you can see it's a pretty robust offering. You know, Kaiser does a great job providing tools and benefits to their members. I like their education classes that they offer as well through Kaiser. All right, moving on to our last small group medical carrier, which is United Healthcare. So United Healthcare has picked their areas they're focusing in right now. For 2020, they're extremely competitive in San Francisco and Sacramento. They're still going to be competitive in other areas as well. I'm just saying in those two regions, they pretty much dominate all the plan designs. They're most competitive. Now, the annual rate changes with United, you can see there, it's broken up by Northern California and Southern California. For the PPO in Northern California, it's 8.3, and Southern California PPO at 6.5. And for the HMO in Northern California, it's actually a negative 3%. And for Southern California HMO, it's 1.7%. Just like I noted with Anthem, these are statewide averages, or region by averages, I should say, with UHC. And those age changes are not reflected in this percentage listed. So if someone changed from 30 to 31, that rate increase is not reflected in this average. That's why when you get those renewals, they look a little higher than what these averages that we state. Now, the good news for United Healthcare in 2020, they're trying to make their portfolio offerings less confusing. You know the old joke in the industry, they call them Choice Simplified and we call it Choice Complex. But with United Healthcare, they had increased up to 5 different Choice Simplified plans, and they also have their state portfolio as well. So they have 6 portfolio offerings. In 2020, United Healthcare will have 4 choice simplified portfolios, but they're organized a little better, so they're easier to keep straight than before. And they will continue to have their state portfolio as well, so they'll have a 5 total. For the 4 choice simplified portfolios in 2020 with United Healthcare, first thing to note is that all 4 include both PPO networks. So that's not what you're looking for. They all include the full Select Plus and the narrow core, which really isn't too narrow. So the difference among the 4 choice simplified portfolios in 2020 is what you see outlined here in the middle. So choice simplified 1 offers 4 different HMO plan designs, and you can see it's Greater LA and Orange County focused. With choice simplified 2, it offers 3 different HMO plan designs in addition to the 2 PPO plans I mentioned a second ago. Choice simplified 3 offers the Signature and the Advantage HMO plans. Now that choice simplified 3, if you're in Northern California, you're going to be focusing on choice simplified 3. Signature is their full network HMO. Advantage is the UHC network that includes the Canopy network that's partnered with John Muir, UCSF, et cetera, and they've really gotten very competitive on those premiums. So you're going to notice those plans are very competitive. They can all be offered side by side, and they get some really top of the line carriers for that, even though it's quote unquote a narrow network. Choice Simplified 4 is for those groups that are located in the San Diego area, and we say that because Harmony is included in there, and Alliance, which are their narrow networks that are kind of geared to San Diego. So hopefully that keeps that more clear. It's more geographic focused than it was before, a little easier to explain, although it might not be as easy as we had hoped. So moving on, benefit changes that United Healthcare is doing is they're going to have what they call quote unquote preferred lab network. So they're going to have in-network labs, and they're pretty much going to have like a preferred in-network labs and regular in-network labs, and then of course out-of-network labs. So what the preferred lab network is it's going to work with those providers to help make sure that there's just not a lot of unnecessary testing going on. So the good news is these preferred labs include the largest labs, LabCorp and Quest. So it's probably not a problem. Your members are probably going to be going to these 2 LabCorp and Quest to get all their work done. And when they do, they get the best benefits through United in 2020. Just be aware that there's kind of set agreements between the providers and United Healthcare on what's going to be included. So, if Jennifer, who's 47, walks in for whatever blood testing, they're going to, just give me whatever a 47-year-old blood test should be, based on my family history as well, of course. But they're not, if I request an executive physical, that's just not going to be allowed off the bat. So it's going to help, make sure that there's not a lot of unnecessary testing going on and help keep those premium dollars down. The next item, UHC has always been a fun conversation with pharmacy, and the big enhancement they're doing for 2020 is that they're going to move to 1 formulary for all small group plans, whether it's an HMO or PPO. So in the past, HMO members worked off 1 formulary, and PPO members had a different formulary, even though all the employees were in the same group contract. So in 2020, they're only going to have 1 formulary for all their UHC small group plans, and you'll see there it's called UHC California Advantage 4 Tier PDL. We don't have a lot of data on how that varies from the current PPO formulary. We'll keep you posted as we gather information, but it is the least easier that everyone's working off 1 list. Now, the nice thing that UHC is trying to work with their providers on is they have a program called Pre-Check My Script. And they're trying to encourage, okay, when Jennifer's at her UHC provider, my doctor would be able to look up the formulary that I'm on to help encourage the doctor to write a prescription off the formulary that my group plan covers, so that we don't have that normal situation where I then take my prescription to the pharmacy only to find out that the prescription my doctor just gave me 5 minutes ago is not on my plan. And then what do I do? And then you get the call, and then we get the call, et cetera. So they're really trying to educate the providers to work off that Pre-Check My Script lookup to write the best prescription for that member the first time. Probably not going to affect a lot of us, but something to note is that UHC is moving from which department in California they're going to file their PPO plans with. So Anthem and Blue Shield have started filing all their plans, HMO, PPO, et cetera, through the DMHC regulatory body. However, UHC and some other carriers were still filing their PPO plans with the DOI and their HMO plans with the DMHC. So as of 2020, UHC is going to be just like Anthem and Blue Shield, where all their small group plans are filed on the DMHC. But this really doesn't mean a lot to us, other than the fact that technically UHC has to send letters out to existing members that are on PPO plans to state your plans are being discontinued. That might create questions to you, and you just need to explain, it's just a formality. You still have coverage with United. Yes, you're going to have a renewal, and your plans might change some like normal, as we've just gone through, but the regulatory body is just changing. They have to notify you technically that your old plan is changing. So just be aware, we've started getting some questions on that. Second to last bullet point here with United is they are going to make some changes to how the out-of-network benefits are paid for outpatient surgery, et cetera. And that's really just kind of aligning their benefits with some of the other carriers, putting like a dollar amount cap when you're out of network, not in network, but out of network. And then just like everyone else, we have the value added on the last bullet point on the slide. UHC also does a great job with a lot of the tools that they provide members just included in the premium. So we get a lot of good compliments to United on their fitness reimbursement, where they're actually going to pay each adult member $20 per month cash if they actually just go to the gym 12 times a month. They also have the teeth whitening program. They also have Smile Direct Club, which is also like those ortho trays that Anthem is covering at 50% off. UHC now has a program called Smile Direct as well. And you can see everything else listed here, but they do a great job with their tools. So moving on here, this is a quick summary on when you can offer different plans and networks together for each carrier. So Aetna has not changed. So the way Aetna works is they don't care whether it's full or narrow or what metallic level. You can put any combination together. The only restriction for all size groups is you can only offer 5 plans at a time. And Aetna really does encourage a group to pick 5 different plans. And that way, the way those plans are just sitting there open, even if they won't have any enrollment initially. Just throw some plans out there so they're available down the road. With Anthem, they've been doing this for a while, and the promo continues. Anthem will offer 2 HMO networks side by side. So you can offer the full California Care HMO network alongside the Select HMO network. That technically goes through March 15th of 2020, but this has been a promo that they keep extending. I think we're on definitely year 2 at this point. And as we previously discussed, Anthem has a current short-term promo, truly is a short-term promo potentially, through January 15th, where only groups in regions 1 and 9 can have 2 PPOs at the same time. But once you offer those 2 networks, you can offer any metallic tiers at the same time. Not a change, so you probably know California Choice in 2019, they started allowing 3 adjacent tiers. The only caveat is bronze cannot be part of the 3. So you can have platinum, gold, and silver together, but if you want bronze, you can only offer bronze with silver. With Covered California, they have not made a change yet. They're like the old CalChoice used to be. Covered California, the only trick is you can still only offer 2 adjacent metal tiers at the same time. So they're the most restrictive on which plan offerings you can do. With HealthNet, they continue to have set portfolios. So with HealthNet, they have Enhanced Choice A, which is really Northern California focused, or Enhanced Choice B, which is Southern California focused. And you can see the difference why we say Enhanced Choice A is Northern California focused, because you get sorry about that. You get the full network PPO plans with Enhanced Choice A. With Enhanced Choice B, the only PPO full network plans you get are the Bronze PPO and the Bronze HSA plans. So that's why we have that outlined as we do. Now I'm ready for the next slide. Okay, with Kaiser, of course, they only have 1 network. That's the beauty and simplicity of Kaiser. You don't have to worry about that. But as far as which plan designs you can offer, as I've already indicated, smaller groups 1 to 5 can pick up to 3 plans. Groups of 6 or more can offer any combination that they want. With United Healthcare too, just as I've already indicated, they have set packages for 2020. They have 4 Choice Simplified, as we outlined previously and again on the slide. So The trick is you just can't take a plan from Choice Simplified 1 and offer it with Choice Simplified 3. Once you set your package, you can offer any or all combinations within that portfolio. Okay, the next two slides are just a quick summary. We get lots of kind of same questions on the things like who's the best fit carrier for certain scenarios. So we just don't have a lot of details on these next two slides, but just some things to remember, and you can always just call us for the details of it. But if you have a group that has a lot of Kaiser members, but of course they don't have everyone that likes Kaiser, really the best homes in our opinion are of course Covered California and Cal Choice, because Kaiser's offered within and there's no limitation. You could have 99 Kaiser members with both Cal Choice and Covered California and one non-Kaiser member. That's completely fine. We have United Healthcare listed here because they require 5 bodies to enroll alongside Kaiser. Those 5 bodies do need to be enrolled in California, but you could have a group of 100 with 99 on Kaiser, I'm sorry, with 95 on Kaiser and 5 on United Healthcare, and you meet their rule. Technically, they say they want 60%, but just like Kaiser, they count the Kaiser bodies in that percentage. And United Healthcare also views individual coverage as a valid waiver, so there's not a lot of stuff that United views as an invalid waiver. So most groups hit that 60%, require no problem. So you're really just looking at, do you have 5 enrolling with United that are living in California? Moving on to the second bullet point. As I said earlier, as ACA surprisingly has come around, carriers are getting more and more flexible just because we have so much business submitted at so much minimal times. So with these carriers, there's flexibility, and if you notice, we're saying we don't need a D9C or a prior carrier bill for these carriers. So with Aetna, a group of 6 or more, we don't need a D9C, we don't need a prior carrier bill, there's no form to sign, you just need to give us the basics, employer apps, waivers, check, and we're good to go. HealthNet, as long as you're offering only HMO plans, which is probably what you're going to be offering because they're focused on narrow network Southern California HMO plans. If you have 6 enrolled, again, there's just no form, no D9C, no prior carrier bill. They just want the documentation of the group apps, etc. Kaiser Permanente too, this is newer for them. Consistent story. If you've got 6 or more, Kaiser just needs the other documents. They do not need a D9C or a prior carrier bill. With United Healthcare, they're a little different, but still very flexible. As long as you have a group of 10 eligible, and that's not enrolled, it's 10 eligible, we don't need a D9C or prior carrier bill with United either. So if you have 10 eligible, but only 6 enrolling, then we see what they call a participation certification form. Next topic is if you have a lot of employees outside of California, which we see more and more of, more people, as you've heard, are moving outside the state of California than in the past 2 years, but a lot of businesses are here because it's a very good economy and a good place to get VC funding, etc. United Healthcare is really our only home, and of course, therefore the best home for it. We do need to know specifically who's enrolling where, because where we write that group policy out of is based on the majority of enrollment, and so the census does need to be pretty specific. But we write a lot of that business, and the only places we can't help you with are Nevada and Colorado. Last item on the slide is PEO spinoffs. This is, again, becoming another big topic we're hearing more and more of. Groups have been with PEO, they grew to about 20 or 30 lives, realized that they could do it all internally and want to bring it all back in-house. We have Anthem listed there. Other carriers will do it in certain scenarios. We state Anthem because they're not only friendly alongside the documentation they require when leaving a PEO, but they give you deductible credit from what you incurred under the PEO plan. All right, the second slide of the best fit carriers includes non-union carve-outs. Covered California is listed here because they just don't need a lot of documentation. You do not have to give a roster indicating the union employees, which is nice. In a group of 6 or more, you don't have to give a T9C. And as I already indicated, Kaiser's listed here because they're looking at how large is the non-union population. As long as the non-union population is under 100, they'll write it. Owner only. So the carriers listed here are the best scenarios for owner only, and we write a lot of startups. A lot of these groups are just owner only, and sometimes they stay owner only, which is fine. But It depends on the company's structure. Typically, if it's an LLC or a corporation, but there's some flexibility amongst some of these carriers, but they don't do it for all structures. But you'll see that Anthem, Cover California, and United Healthcare are friendly with the owner only, and Kaiser is too. In addition, they will cover those husband and wife corps and LLCs as long as the husband and wife will be on one of the, either husband or wife will be on the D9C. So that's the best scenario there. Lastly, startup groups. So Anthem has been dominant on startup groups because you do not need payroll before the request effective date. The group just has to be filed with the state of California to do business here. Covered California is listed here because they're flexible. They don't need payroll, but they'll take a W-4, a letter. Kaiser Permanente, a new announcement for them is they are going to match Anthem, where they now too have that attestation form. They don't need that payroll. They just need to have the group filed with the state of California. We can get them up and running. The difference is Kaiser, however, states they will ask for that payroll. Anthem says they may ask, and they honestly haven't asked a lot that we've seen, but Kaiser is saying we will ask, you need to give it to us within 30 days of the request effective date. All right, special open window groups, we all know about this. As I alluded to earlier, these are the groups that have to enroll between November 15th and December 15th for 1/1 effective date, but they won't be declined based on participation or contribution. The first item listed here is reminders. These groups still have to be small group. So you still have to be 1 to 100 full-time equivalents, and we still need absent declinations from all eligible. So we can write just one employee out of a 100 life group, but we're going to need 99 declinations for those employees. And there are strict submission deadlines. These carriers really don't want these groups, so they try to, state, hey, as long as you follow the rule and get it in, we have to take you. But if you miss that deadline, we're not going to be lenient. Some of the carriers have changed through the years, but in general, those are the reminders. Now, I'm not going to walk through all of these. As I've previously indicated, Covered California is the best, and that is because they will allow you to keep Kaiser direct as well as write alongside Covered California. And Covered California will renew these groups. If you're not offering Kaiser to a group, it opens up all other carriers, I should state. So just be aware of that. You're not, only have Covered California for this scenario if Kaiser's not being offered. Then there's some carriers like United Healthcare that it's okay if you're offering alongside Kaiser, but they state they may not renew you in these scenarios. So you're looking for a 1-year home. What's new for 2020, and I'm not sure if everyone knows about this one. So you probably remember that at the federal level, the penalty for not having health insurance per the ACA was dropped down to 0. So technically it still exists, but it's 0. So, not a lot of requirements to have individual health, not a lot of incentive, I should say. However, some states have reacted to that. Of course, California is one of the states that's probably going to react, and they did. So California has new legislation called SB 78, and this is effective January 1st. This is going to impose a penalty for individuals within the state of California that do not have health insurance. So everyone needs coverage as of 1/1 in the state of California. If they don't, they will potentially have a penalty of $695 per each adult, and I think it is about $350 per child. And we have a nice kind of single page or 2-page document that explains this, what's going on. But this flip side of this is the state of California will now give a subsidy to more people that didn't qualify under the federal program. So kind of it's the carrot and the stick. They're saying, hey, you need to enroll, you have to have health insurance, and we're going to help you. We'll help more people based on their income than the federal subsidy did, but if you don't, there's a penalty. So as a result, some of our carriers, and you'll see listed here, who is now creating this one-time special open window for individuals. So we're talking about if a group has one of these carriers' small group plans, and they're not necessarily enrolling or renewing January 1st. So let me back up a second. If the group is with Aetna and they have individuals on the policy that actually declined coverage, and we don't know why, maybe just because, most likely they couldn't afford it. But as of January, as long as that member submits an application from 12/1 to 12/20 and it's going to be off the group's anniversary date, for 1/1 effective date, they will take that individual onto this at a small group plan. Covering California is going to do the same thing. They're more a little lax on the submission deadline. Sorry, there's a typo there. We need that submitted by January 31st of 2020. It was 20, not at 2031. That gives them a lot of time to enroll, so we'll fix that for you. And then HealthNet has announced we may do it. It's a case-by-case basis. Just contact your HealthNet account manager. And then Kaiser United have also said, yes, we will allow individuals on our group policies to enroll for 1/1 effective date because of this new California legislation. So just let us know if you have any questions on that, because it's definitely new and not sure if everyone's familiar with this scenario. All right, another little quick reminder is some new legislation that, or not legislation rather, the IRS came out earlier this year and said that carriers can, if they want to, expand the preventative care on HSA plans to include basically more items would qualify for preventive care than they did before. This is optional for carriers. I've gone to all the carriers, and currently at this point in time, none of them have done this. They may do it in the future, but really by the time this was announced, their January 2020 plans had already been filed with the state of California, because they have to do that back in June. And so they didn't really have time to do that. Some may open it up. It is optional, so not all of them will, and we'll keep you posted on that. All right, all the Q1 rates were available in our quote engine as of October 17th, which was a little earlier this year than the years past, which is nice, because the minute we've been getting those December rates out, which we get them out in July now, which is very nice that the carriers give you a lot of time to work with all those 12/1 renewals, the first thing out of our brokers' mouths is, well, when will we get the 1/1? So we did have it earlier this year, October 17th. We have all the 1/1 rates. Let us know if you have questions or need help quoting. Good news, no changes to medical commissions this year. So everyone continues to pay a flat 5%. There are some kind of different ranges behind the scenes. So kind of levels they drop off at, but overall it's a flat 5%. In addition, as you know, the market's been extremely flat the past 2 years. So basically all these groups have been renewing, all the carriers are looking for membership. As a result, all the carriers listed here, which is pretty much everyone, has a broker bonus program. And they're kind of very elaborate sometimes. So we have a tool that you can use to look at to see what all the details are. So we have a broker bonus consolidated tool that you can look at. All right, just a quick one slide on ancillary. Anthem is pushing their ancillary very hard. It makes a lot of sense nowadays because they've really improved the product itself. Now they've actually improved underwriting rules. So if you have a group that you're offering dental or vision, and really maybe it's a voluntary group, but as long as you're getting 25% participation, they will actually give you employer paid non-voluntary rates. So you're going to get the better rates because you're getting 25% participation. So that's really enhanced sales around here lately. They've also lowered the group size of when they'll get better rate discounting. It was 26, and now they're going at better rates at 10 plus. They're also enhancing the product even more. So with Anthem, as of 2020, they're going to have an unlimited annual maximum. I think there's another carrier out there that's been selling a lot of this, and now Anthem will have it as well. Again, an unlimited annual maximum with Anthem Dental starting in January. They're giving more options on vision plan frame allowances that you can see there. And they're the only carrier I'm aware of that will do the special open window that applies to specialty. So something to remember. Choice Builder, nothing major, but just a reminder for 2020, they have new chiropractic lower fee schedules for certain areas. Delta Dental has a product called Allied Benefit Suite. As long as you're buying the dental through Delta, then you can add on any or one of these lines of coverage. So there's vision through VSP, there's AXA Life and Disability, and there's that personal protection plan, which is like legal assist, global med, etc. So again, you're buying the dental, and you can buy any or all of these other lines of coverage. If you just want to do dental and vision through VSP, you're good. Essentially, it is kind of 2 enrollment processes, but once the group is approved, you get 1 bill, etc. going forward. Delta has had another rate pass. I think we're on year 7 of a rate pass for this pool. So getting even more and more competitive with Delta. Guardian just also decreased their rates recently, so it's an average 8%, but smaller groups, they have actually decreased their rates 20%. So our Guardian sales have increased as well. Principal has announced that they have a true open enrollment for certain amounts of voluntary term life. Usually, it's kind of take it when offered and that's it because it's voluntary, but they're going to have a true open enrollment. And VSP, like Delta, has announced they too have had a rate pass. So I think this is a couple years in a row for VSP for a rate pass. And MetLife is not listed here. They don't have anything necessarily new for 2020, but definitely selling a lot of Met, good products, good people. And so don't forget, we represent MetLife as well. All right, almost done. So some quick reminders for Q4. For Q4, we know you know this, but it is a very busy time, so some things to remember. When you're moving a group from one carrier to another, please try to ask them about any COBRA or more importantly CalCOBRA members that they might need to reach out to the carrier and ask about. They probably don't even know about them because those CalCOBRA members need to be moved from one carrier to another as well. As we approach December and January, as we get there, please remember to remind those members to go ahead and get prescription refills so it's not that lovely December 2nd and they're standing at the pharmacy waiting for their group approval and waiting for the prescription that they desperately need as well. Something that we don't talk a lot about, but something that members need to know is that they're doing mail order for prescriptions. They need to remember to stop that through the current carrier and move it over to the new carrier. Sometimes we've had the mail order drugs delivered because the group wasn't canceled right away and that delivery hit, and so that can cause some issues. And as we have all learned through the years, it's important once kind of the dust is settled to make sure that you audit the enrollment, the plan selections, the networks, the PCPs, making sure that everyone's where they're supposed to be. And the sooner we're aware of that, the better. Carriers are really tightened up. If you notify us 6 months down the road, oh my goodness, they should have been on the narrow network and they've been on the full network this whole time. That doesn't always go so well. It's not as easy to fix. But Randy does a great job getting a lot done. But just so you can always reach out to us, we'll always try, but the sooner the better. And then, of course, once we get all excited, once we get the group approval, but you have to remember to cancel the prior coverage as well so you don't go to collections. All right, in the last few minutes here, some quick summaries on B&P. Don't forget to don't be shy. The more you bug us, the more we like it. The team here throughout is very responsive and knowledgeable and very professional, so we're here to help you. You can't bug us enough. As far as upfront sales, my reps go to you guys all the time and update you on the latest and greatest, keeping you on your toes because we know you're selling a lot of other different products and carriers out there. Let us do the quoting for you. If you want to do it yourself, but you're at the group and you want a quick update, don't be shy. You can still call us and we can help you with that. What I love is helping with sales strategy. I love working at GA because I'm not, just selling one carrier. I can always listen, what's the group asking for, be more consultative, what's the best fit, and find the best home for them. Because when you do that, they're more apt to stay with that carrier versus trying to force something that's really not a good fit. We all know about network searches when you move from one carrier to another, but just a reminder, these prescription searches have become even more and more important because the formularies have changed, like United Healthcare's formulary is changing. So you want to find out when you're moving from one carrier to another, are the drugs that the owner's wife, the joke, is on, are they going to be covered through the new carrier? Because you want to be upfront about that and not find out when she's standing at the pharmacy, finding out that those drugs that she's taken the past 10 years are no longer covered with the carrier you just moved them to. We can certainly help you with employer presentations. We can help you with renewal strategy. Under the tools and resources section, you'll see that we did enhance our website fairly recently. We have SBCs by month for each month of the year rather, because per the Department of Labor, if you get audited, your SBC really needs to say the renewal month that you have. So if you're a December group, the SBC, the top right corner has to say specifically December 1. It can't say January 1 forward. Per the DOL, that's not compliance. We've added a lot more carrier brochures. We added a search feature. And we also have custom generators where you can go on. So if you're just looking for what are the owner-only rules with, say, Anthem and UHC, you don't want to see all the other carriers, you can just get those results and send that email to your client. And we always have a ton of tools. I couldn't be able to show them all to you today on rates, benefits, networks, underwriting, legislation. If you're ever looking for something, just give us a call. All right. Once you've sold the group, we can help you in a lot of different ways. So Call us today. We can have enrollment kits to the hard copy, if you're still doing hard copy, to the group tomorrow, which we're still doing a lot of those. Still like 90% of our stuff comes in through paper, but we do 10% through online enrollment. We also have soft copy versions, which are very popular. We can create custom worksheets for those odd contribution schedules that are out there in the world. We have free initial online enrollment through EASE, we call BP Enroll. And so if you want to let the group enroll online, we can do it. And now EASE has a program where you can actually, up to a certain number of subscribers, give them ongoing throughout the year through us for free. But once you get to 300 subscribers, you really need to have your own subscription as a broker. Once you have your own subscription as a broker, then Beere&Purves, when you sell a group through us, we'll reimburse $1.40 per employee per month for the first year towards EASE. And as always, we will help you with any new and open enrollment meetings, and we have bilingual enrollment meetings as well. Underwriting. B&P prides ourselves on underwriting. We have a great reputation with our carriers to submit very clean groups. As a result, we get very, very good turnaround times. So we have real-time eligibility with Anthem. Our approval time with Anthem is less than a day, and that held in December of last year when they were writing a lot of business. It was still extremely fast. We have group approval letters that you can tweak and make sure, make it look like it's from you. We don't always want the credit. Just trying to give you tools to make your life easier, more profitable, and you can sell more. We can help with member identification or verification, benefit modifications, and what's very prevalent this year is a lot of groups who are getting recertified with the carrier, and please let us help you with those throughout the year, because we can make sure that the group is kind of teed up before we submit it in and get that group recertified quicker. And lastly, the ongoing service that B&P is known for. So once a group is in force, our inside folks kind of become the account manager. We can help you with new hire processing, terminations, billing resolutions, claim assistance, and we can help you with EASE. So a lot of brokers had an EASE subscription. They didn't really like all those daily emails that happen when the group makes changes. Beere&Purves can receive those emails on your behalf. Go in there, find out the group, find out the change, and process the change with that carrier. If it's not a carrier that we represent, then we would just email it to you, but you didn't have to get that email, dig in, find what it was. We've kind of teed it up for you. All right, some quick reminders here are a sample of some of the tools that we have. So for example, one thing we get asked a lot about is this tool that's the competitive plans by county. And on this tool, you're going to see that there's a lot of information for one, so let me try to make it bigger for you. But as I indicated with Anthem Region 1, for example, Anthem is the most competitive on almost all the PPO plans here for quarter one. If you look at San Francisco, United Healthcare is very prevalent up in San Francisco right now. So this is by rating region. We look at the most competitive PPO plan by plan level. So here's Santa Clara County, and you can see the different plan designs listed on the left. And you can see Anthem has a lot of plan designs that they're competitive there. This is really good for an area that you might not focus on, but you get a random group, and so this kind of helps you be more knowledgeable about the area. Another tool that I like as far as benefits is this portfolio and network glossary. We do this, we have all the carriers, we break it down by network. So this is showing, here's the Aetna plans. Maybe you haven't sold them a lot, you don't remember which networks they have. These are all the ones that they offer. All the plan designs, explains what it is, what's the full, what's the narrow. Then we break down the networks. You can see they have a lot of different networks. You can see actually the number of providers within each network, so you know which one's larger versus smaller. We get lots of questions. Who's the behavioral health carrier or provider for each carrier? We have that on here. We have the Pete Dental carrier, we have the Pete Vision. So the formularies on here, a lot of good information. Just want to make sure some of the tools that you have at your disposal that you may or may not remember. All right, with other resources, I wanted to point out we do have this policy year change. So I indicated that Anthem is allowing groups to move from, say, a December to January anniversary date. All the carriers have some rules about it, and so we have a tool for that. I'm not going to go all through this, but just a reminder, we have it all broken down for you. And if you ever have a question you need answered, let us know, and then we'll gather all the information, create one of these tools, and keep you out of trouble. All right, we've always had our broker picks program. What that is, it's a subsidy. So based on the group size, you get one of these items. If you have an ease subscription, most people take that $1.40 per employee per month that I mentioned. But if you don't have an ease subscription, because not everyone does, you can take it for Cobra, for ERISA, et cetera, et cetera. So that's just a reminder of that. And lastly, before I let you go for the day, I know we've gone over a little bit, a reminder that we did sign a new contract with Anthem Blue Cross Large Group. It's for 101 to 300. It's a pooled product. You're going to get the same, the groups can get the same premiums, you will get the same commissions, and any broker bonuses that you would get from Anthem, you get when selling through Beere&P, and that's unique to our Beere&P GA contract. So any broker bonus that you qualify for, when you put the group through us, it does not affect that. The reason, in addition, since it's all the same, why would you use us is just like small group, we've got a great relationship with Anthem. We work very well with them. And when you send the quote to us, we clean it up, we code it to how their underwriters want everything received. And that way, when their underwriting department gets it, they can work with it a little faster. They've had a reorganization. Honestly, it was a little bumpy right when we got the contract, but it's kind of smoothed out now. So we can help you get the quoting faster implementation, and we can help with unlimited enrollment meetings just like we do in small group. Because of the sake of time, I'm going to kind of skip over some of the large group tidbits, but just give us a call. But I do want to remind you that if you sell Anthem Large Group with us, we have a large group broker picks program. So the difference mainly between small group and large group is the large group program is ongoing, where the small group program is for first year only. When you sell an Anthem Large Group through us, you have two choices. Do you want this Alliance Access Plan, option 1? It's a $6 value per employee per month, and it would apply to all the Anthem members, not the Kaiser members. And it would give those members ID theft resolution, legal club, and global emergency. If you don't like that program, you can take option 2, and we will help subsidize something that benefits the employees like our normal broker picks program does, but it's ongoing. And the subsidy amount, if it's Anthem only, no Kaiser, would be $4 per employee per month ongoing. If you have Kaiser in the mix, that's fine, but the $4 drops to $2.50 per employee per month. But that $2.50 will include the Kaiser members. So I know this has been a lot of information. I apologize. I rambled on a little bit, went beyond the hour. So if you have any questions, we'll get back to you. We will be sending out a copy of this presentation. Thank you very much for attending today. I know this is a lot of information, but you can always just contact us for the details. And I really appreciate your partnership and all the business you place with Beere&P. And don't forget, we do have Kaiser now. You guys have wanted that, and we do have it for December 1st. And we will be sending out a copy of the slides as I indicated. Thanks so much for your time, and hang in there and let us help you with Q4.